Welcome to the Counselor Soapbox video, Learning About Alcohol Part 32, where we discuss special populations, counseling women about their substance use disorder. Women, treatment issues. Alcoholism was traditionally assumed to be a male problem. Research and treatment was largely based on men's experience. Women in treatment often have more than one minority status. They may be female, lesbian, they may have ethnic issues, or have been victims of abuse. Women may be more motivated by their children than men would be. There are ways women substance users may be different than men. One way is their triggers. Divorce, separation, or desertion of a spouse can be a major trigger. Physical illnesses are more common. Death of a spouse can be a severe trigger. Often, men do not wait for incarcerated women. Women may be waiting for their man who is away in prison to return from home, but it's not unusual that when a woman goes to prison, the man gets into a new relationship. And children leaving home can be a trigger for women, as well as the need to have an abortion or the loss of a child. Other ways women substance users may be different than men. There's a telescoped course of the disease. Problems develop much more rapidly. Medical complications takes less of a substance to result in medical issues for women than it does for men. More ways women substance users may be different than men. One is their entry into treatment, which is more likely to be pressured by their children, child protective services, co-workers, their family, and physicians. Other women's issues which must be dealt with during treatment include history of domestic violence, history of rape, molestation, or being abused as a child, incidents of date rape. They are much more likely to be a single parent. Women also have significant economic issues, lack of a work history, lower wages, and frequently lower educational levels. Other women's treatment issues. Women are more likely to be prescribed and to abuse prescription medication, more likely to be forced into prostitution, and more money-type crimes, more likely to have written bad checks or been involved in shoplifting. Often, women have been introduced to drugs by their partners. They have more hospitalizations and may have more psychiatric issues, or at least diagnosed with them more frequently, and more suicide attempts. Issues to consider when assessing and treating women. Women often underestimate their alcohol consumption. When they're shown empty glasses, the one they picked was larger than their reported drinking. Childcare is often a barrier to getting women into treatment. Children who accompany their mothers into treatment appear to have fewer emotional problems than children who are separated from their mothers while their mother undergoes treatment. Other issues when assessing and treating women. There's more need for co-occurring treatment of mental health challenges. Use during pregnancy can have lasting effects, and concerns about sexuality need to be addressed during treatment. Another important issue when assessing and treating women in substance use disorder treatment is the combined drug use. Often, alcohol has been combined with prescriptions, nicotine, marijuana, and other street drugs. Some issues for women in treatment. There are specific women-only AA and NA meetings, and they are highly recommended. There's a phenomena known as 13-stepping. Now, there are only 12 steps, but some people improvise a 13th step, which is falling in love or meeting a new love object, thinking that that will make them happy and fix their life. Unfortunately, that new love object often turns out to be a distraction from doing the work of getting into recovery and staying clean and sober, and can lead to early relapse. Some other issues that arise with women in treatment: fewer women have private insurance. There are more child protective services cases. The children need services also and are much more likely to be in the custody of the mother. And there's a huge need for gender-specific treatment. Not all of the treatment methods used with men are applicable to women. Women after treatment. Programs need to address the risks of relapse. Women are often encouraged to or tempted to use because of their male partners. They are likely to return to a home where a man is either using or selling. They're often low income and dependent on others, and because of their lower educational levels, they have fewer job and employment opportunities. More considerations for women after treatment: the probability that they will have poor health care. They may have residential instability. There may be challenges in the roles of the fathers with the children. Some are absent, some are negative influences. There may be new partners, and women frequently need treatment for smoking or nicotine addiction. What's ahead on the Counselor Soapbox video channel? More videos on drug counseling, drug education, mental health, and wellness. If you've enjoyed this video, please click the like button below. Comments are always appreciated. And if you want to see new videos in this series, please subscribe. Thanks for watching. For more information, please visit my blog, CounselorSoapbox.com. David Joel Miller fiction and nonfiction books are available on Amazon.